Hello viewers, I am Dr. Varsha Patil, a fertility expert working at Hope Infertility and Janani IVF Center. Hope Infertility, since it was my one of the first centers, it was for the regular people, it was for the middle class, the locals, for everyone generally. And we did get good success in that, and we are still surviving here. But I must say that Janani is way closer to my heart because it serves to the lower income group people and people who can't afford IVF cycles. So this is what I do presently. This is my today. But how did Bella wanted to know how did I get through with my journey till here. So going back, I got married very early. I was in school when I got married. I did my MBBS at Belgaum JNMC. After that, during this MBBS period, I got 2 babies. With these 2 babies, I started to work with Karnataka Health Institute as a doctor who would visit and who used to mostly stay in the labor room. I used to be in the labor room as a doctor, especially at night duties. Now, while doing that, I saw that lots of women do not have chance to pregnancy. I also saw that many of them were malnourished. Also, they were very young. They were getting pregnant very early, or there were women who were not even having a chance to take treatment or take proper treatment. When I say proper treatment, I mean the fertility window was missed. They got treatment quite late in their reproductive life. All these things led to some kind of problem with their fertility, with their conceiving. Now, I was working there, so I got an idea about the society and how this infertility is affecting so many families. At the OPDs there, I would meet some couples, especially the ladies I would meet, and I hear from them, Madam, ಏನ್ ಬೇಕಾದ್ ಮಾಡ್ರಿ ನಮಗೊಂದು ಮಗು ಬೇಕು. So that was such a touching experience for me that stayed with me. So with that thing, I started a IVF center. I took my training at Sydney IVF in Australia, at Sydney. From there, I got 2 doctors to come and visit my place here in Belgaum, the scientists actually. Irina Lalik and Rosemary Kalinan, they became very good work friends. They used to come down to Belgaum, they helped me set up the labs. They even helped me with the protocols, like how and when what should be done in these infertile cases to get the best success rates. So what I noticed there is that there are people who are ready to help you. They did not charge me anything extra for that, but their airfare. But they were just wanting to help out another colleague to do the best for the society. So I happened to meet these 2 lovely ladies who had very good hand at their embryology work. After that, I did go to UK, Leeds University, to do my master's in clinical embryology. There I met Dr. Helen Picton, who was the HOD. And she was such a calm and dedicated person, a very good doctor, and learned quite a lot with her as well. And then I started my second center, Genesis, in Bangalore. Now with Genesis, I used to get lots of course the Bangalore crowd, but I used to get a lot of patients from Tamil Nadu, I used to get a lot of patients from, I started getting patients from USA, from America. When I got the patients, they used to come through one company, surrogacy abroad, and they used to get like 5 to 10 couples for me every month from US, and I used to do their cases there. It was doing wonderfully nicely. The success rate was also very high. And then my family, especially my maternal side, they wanted me to come and take care of some of the matters which my father had left halfway. My attention got a little bit diverted from Genesis to my maternal side. So in between, since I had to spend a lot of time traveling, I decided better I shut down Genesis. And those equipments from Genesis IVF Bangalore, I donated those to Janani. So it was from Genesis, it went to Janani. Now Genesis used to serve for international patients, high society patients, earning a lot of money. But here at Janani, it was totally opposite. So here the cause was so big. I must say that both the centers gave me a lot of joy once there was a pregnancy, once there was a happy note for the couples. But I would, at this stage and age where I am, I would love to go give back to the society. And with Janani, I'm getting that in huge load. I'm getting such a big satisfaction to give back to the society, to work for those couples. And we have achieved so many pregnancies for 35 and above, including someone who's 45 years old lady who's got pregnant and has got babies. Someone has got twins, someone has got single baby, but they're very, healthy babies, healthy mothers, and they're very happy. And I'm happy to be part of this journey. To the women who are getting up and starting their careers, I would like to tell you few points of my life. One of the most important thing which has got me throughout this journey is the dream that my father noticed that I would become a good doctor. He noticed that and he mentioned that to me. Even I thought that I had more empathy. So I thought, yes, this is what I would like to do. Once that was decided, the journey began very young with those doctor stethoscopes, trying to be a doctor while having small plays. Like that I started it. And now when I am here at this stage also, I'm very happy as a doctor. I love this profession. I know it's somewhere inside me. So you should have loving for whatever you want to do ahead in your life. Once you have that goal is very important. Have the target set. Once you have the target, you have a goal, and then you should not hesitate to do any kind of hard work, I feel. You should go through with everything and help comes. Like I got Rosie and Irina in my life, even Dr. Helen. Like that I've got so many people who have helped me professionally. So many doctors even locally. So the thing is that help comes. Only thing you have to get up and start. The day you feel most lazy, do not stop there. Just get up and start your work, and start with faith in your heart and be ready to do everything possible to get to that goal. You will, and my best wishes for you all. Thank you.